Hello everyone and welcome to Virginia Medical Update Show. I'm your host Mahnarjan Mahmadova, happy to be here with you today. Today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of specialties are in weight management, preventative medicine, and holistic health. Today, I would like to introduce to you a practicing pediatrician at Metropolitan Pediatrics in Arlington, Virginia. She is a member of the American Academy of Pediatrics as well as the AAP Council on Early Childhood and the AAP section on obesity. She is currently the president of the Iranian American Medical Society of Greater Washington, a society dedicated to education of physicians, networking among Iranian American professionals, and embracing cultural values. It is an honor for me to welcome Dr. Azadeh Sami. Dr. Sami, welcome again.
Thank you so much for having me on your show. Thank you.
Thank you so much. So, Dr. Sami, today's topic is summer safety, or how to stay healthy during the summer, how to protect our children to stay happy and healthy during the summertime.
Yes.
So the question is, the first question I guess here, it should be how to protect, and what would you suggest, what could you recommend as a pediatrician to use basically what type of the sunscreen we can use during the summertime, especially for children?
Yes, that's an excellent question. It's a question we get quite frequently, actually. So first of all, I should say that sunscreens should not be applied to babies under 6 months of age. For those younger kids, you want to have them just wear light layered long sleeves and pants, and as well as hats. As far as the SPF that we recommend for the older kids, we recommend SPF of 30. Generally, anything higher than a 30, you really don't get that much of a different effect. And of course, it is something that should be reapplied every couple of hours because it may wear off. And also, we generally don't recommend applying it to the face and the hands for the little kids because they can put it in their mouths.
So in this case, Dr. Sami, how can we ensure the safety of children?
In the sun,
yes.
Specifically?
Yes,
in the sun.
Absolutely.
So basically you want to, another thing that you can do is try to avoid taking them outside during the peak hours between the hours of 10 a.m. and 4 p.m. as much as possible. We understand that that's not always possible, but as much as possible you want to try to avoid those during those peak times. And always, 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 you again, just bring the sunscreen with you, keep reapplying it, and don't forget the long sleeves and the pants and the hats as well for all the kids.
So you would definitely recommend to basically, if baby borns, if mothers would like to basically go outside with their children, they have to do it before 10 a.m. or after 4 p.m.
That is correct. Yes, that is correct. For the babies under 6 months of age, they should always have them covered in a different way, not to use sunscreen necessarily. And whenever they take them outside, make sure that they're nicely covered.
Dr. Sami, you mentioned about how can we ensure safety in the sun. So I guess the next question that I have, how can we ensure safety in the pools?
That is also an excellent question. So as we know, a lot of the kiddos are going to be spending more time in the swimming pools. Of course, you always want to make sure
and the kids love it.
Yes, they love it. They love splashing around in the water, and we
That's
encourage
right.
them to do that. In addition to the sunscreen that we just discussed, another thing is you always want to make sure that there's a responsible adult within arm's length when the child is in the pool at all times. A couple of myths, of course, that have been brought up by parents. One is a question about the inflatable devices that sometimes they have the kids wear in the pools, and some people are under the impression that
what kind of devices? I'm sorry.
So inflatable floating devices. So the floating devices that they can wear, they can put on kind
That's
of like
right.
a vest. So a lot of people are under the impression that actually can take the place of life jackets, when that in fact is not the case. So again, the best thing to do is to make sure that there's an adult within arm's length, so that if in case that something were to happen, they would easily be able to reach into the water and grab them out. Another thing is that another thing that we recommend is that for the home pools, it's best to have a gate that's established around the entire length of the pool.
Why?
Because we want to make it as difficult as possible for the little ones to be able to get inside the pool. And we want that gate to be able to open towards the outside, so they won't be able to easily push it inwards and be able to get in that way. So we recommend, actually the American Academy of Pediatrics recommends that it opens towards the outside.
So everything for the protection of our children.
Yes, that is correct.
That's wonderful.
Yes.
So what insect repellents are the most effective for children or junior youth?
Right. Well, that's another good question. So insect repellents are also, I mean, there's many different kinds out there, and it may be difficult to decide which one to choose from. First of all, I should say that they should not be applied to infants under 2 months of age. And as far as the different types of insect repellents to choose from, there's the ones that contain DEET, which is a chemical that immediately it just, the insects can detect it, the smell, and it keeps them away. And that's something, the DEET-containing insect repellents can be applied onto the clothes and to the skin, but definitely, again, not on the hands or on the face. And it's best when it's applied every 2 to 5 hours or so. Now, there is the concern.
Sorry, is it matter if the kids are gonna go inside of the pool and then come back, you need
Correct.
to reapply that?
That is exactly.
Or just 5 hours nonstop?
That is exactly the indication for reapplying it. So anytime it wears off, the same thing goes for sunscreen and for insect repellents. Anytime it wears off, whether they're sweating outside or playing in the pool or it rubs off in some way, it's best to be reapplied. And so that's what that means. Now, out of concern of applying a chemical to the skin, many parents have looked into alternative insect repellents with alternative ingredients, such as picaridin and essential oils. Unfortunately, those have only been found to be partially effective compared to the DEET-containing insect repellents. So still the DEET-containing repellents are the best ones. There's another kind, there's another substance out there called permethrin, and that is another substance that can only be applied to the clothes, not to the skin. What it does is it actually kills the insects right on contact. So as soon as they hit the child's clothes, the permethrin kills them on contact. But again, that's one that shouldn't be applied to the skin, only to the clothes. And in fact, I should say that
Or only if it's necessity?
only if it's necessary, correct. Now, I should say that this is something new that came out by the CDC, the Centers for Disease Control. And as far as if you happen to find,
I'm sorry, what is the CDC?
Oh, the CDC is a it's a nationwide governmental federal program that is basically what they do is they study the various diseases within the United States, and they give reports on the prevalences, the incidences. They do studies on those diseases, and they do a very good job of informing the public about these diseases. And they have a great website that we encourage parents to go to, cdc.gov, and we highly encourage parents to go to that website whenever for information on any disease. But they actually came out with a new study that they found that if you happen to find a tick on the child's clothes, before they were saying you should put it in the dryer for 1 to 2 hours, now you only need to do it for 10 minutes. 10 minutes has been found to be sufficient to be able to kill the tick on the clothes if you happen to find a tick on a child's clothes when you're taking a look.
And it could be not only child clothes, but also adult clothes.
Oh, yes,
well.
of course. It could also apply to adults. That's a very good point, yes.
That's a very interesting. Since you mentioned about the pig, my next question would be, how can one or how can parents identify if the children has a Lyme disease, symptoms of the Lyme disease, I mean?
Right, that's a very excellent question. So as you know, we live in a region that is endemic for Lyme disease, so it's very good to be aware of those symptoms. First of all, I should mention that Lyme disease can only be transmitted by the deer tick or the black-legged tick. And another thing there's lots of things that has to happen before it can transmit to Lyme's disease. So first, it has to be a deer tick. Second of all, it needs to be engorged and on the child's skin for at least 36 hours for it to transmit the disease. Now, if the parent is able to remove the tick and it's still intact, then we encourage them to bring it to the clinic so that we can send it off to the lab for an analysis and it can confirm whether it was indeed a deer tick. And now in cases that we don't have the specimen, we can basically just go off of the other symptoms that the child may have. Namely, there is one symptom that people can exhibit that is actually diagnostic of Lyme disease, and that is the bull's eye rash or the erythema migrans rash. So it basically looks like a bull's eye. And this is another case where we encourage the parents to go to the cdc.gov website. There's some wonderful pictures on there, as well as how to appropriately and correctly remove a tick from a child's body. There are certain things that you should and shouldn't do when you remove a tick. So if you look at the rash, it actually looks like a bullseye, where it's the center is red, and then it tends to clear as you go outwards, and then again around it you have another like a red circle, like a red ring. And so that is a telltale sign of Lyme disease. However, because only a small percentage of patients present with this rash, there's many patients who don't exhibit this rash and they have Lyme disease. So we basically have to go off of the other symptoms, such as muscle aches, joint pain, and fevers. At the end of the day, if they don't exhibit any of those symptoms and there's still a concern that they may have Lyme disease, we can always do a blood test 4 weeks after.
How you can identify basically
Basically,
those symptoms.
That is a clue that we can use. And at the end of the day, we take a lot of these things and we put it together to make one diagnosis. There's no one way other than this bullseye rash that we can be able to definitively make the diagnosis. So we put everything together. Also, people should be aware of lookalikes. Namely, STARI is another disease. Stands for Southern Tick Associated Rash Illness.
What is that?
So that is another another disease that actually the rash is very indistinguishable from the Lyme disease rash. It's transmitted mainly by the Lone Star tick, so it's a different kind of tick, and that has been actually identified in our region as another prevalent disease. Now, luckily, although this one, the symptoms of the rash and the symptoms are pretty much indistinguishable from the Lyme disease rash, luckily it doesn't tend to lead to any chronic long-term sequelae. So even if this goes missed, the child pretty quickly can get over the symptoms. But that is another one that we need to be aware of that looks very much like Lyme disease.
Wow, what are informative and very, I would say, very on points that you mentioned today, and tips for our patients and for the viewers.
Thank you.
I hope everyone enjoyed watching our program, and I guess the topic about the Lyme disease could be a whole another topic, and we definitely would like to invite you to come back and have many more programs. Thank you so much for joining us.
Thank you so much for having me. Thank you.
Thank you. Dear viewers, we hope you enjoyed watching Virginia Medical Updates. Please feel free to share our videos on social media such as Facebook, Twitter, YouTube, and all other social media accounts. I'm your host, Mahnurjan Mahmadova, wishing you many more happy and healthy days. See you in 2 weeks.